If schools don't open, then that can add an additional 5% to the absenteeism in the workforce. So it is absolutely essential for schools to go back safely and to remain safely open if we are not to see any further exacerbation of the workforce challenges we're currently facing. So schools open means shops open. Schools open means hospitals are open. It means aged care facilities are open. It means essential services and groceries are on the shelves. That's what schools opens mean, and it's very important they go back. And the health advice is they can go back, and the Chief Medical Officer may make further comments on that. We agreed some key principles today, and they are, and next week the detailed operational plans will come back, which will deal with the role of surveillance testing, with rapid antigen tests where that's deemed necessary. It'll deal with how that applies to staff in particular. It'll deal with mask wearing, and those arrangements are being worked through by the states and territories now. But the first principle is that childcare and schools are essential and should be first to open and last to close wherever possible, with face-to-face learning prioritised. Now, we note in particular in South Australia and in Queensland, they have delayed the full reopening of schools by 2 weeks. That is on the basis of the estimated peak of the virus in those states, and to align those opening times around that issue. So there is some specific medical reasons while they are doing that in those 2 states, which is recognised and understood by the other states and territories. But we note that in both of those cases, those states will have the ability for children of essential workers, which covers all of those groups I mentioned before, to be able to send their kids to school on that day. So they are still addressing the key workforce need, and we hope they'll be getting as best a possible education for the children of those essential workers when they go back. That baseline public health measures continue to apply. That no vulnerable child or child of an essential worker is turned away. That responses must be proportionate and health risk-based. That childcare services and schools are equipped to respond on the basis of public health advice, with support from public health authorities where required, and the wellbeing of children and education staff to be supported. So supporting essential workers in education and childcare will be important, and the Commonwealth and the states are working together to have 50-50 funding arrangements in place to ensure that is put in place, certainly by the time school comes back, and we'll have a bit more to say about that next week, not unlike how last week we talked about concessional access. We're able to detail those plans over the course of this week and bring them into agreement now. So a fairly busy day with the focus very much on keeping Australians at work and keeping Australians out of hospital. We keep achieving that as best as we possibly can. That enables us to push through.